Good evening, everyone, and thank you for joining us tonight. I'm Stan Lozinski of Comprehensive Financial, and I'm joined here tonight by Mary Parker of Senior Healthcare Solutions. Mary and I tonight are going to present to you some information regarding navigating 2025 related to Medicare insurance and also some Social Security updates as they're becoming available. I'm going to do a screen share right now, and we're going to start the presentation. So again, thank you again for joining us. And as we're talking here, and just for a little background, some basic information about my firm, Comprehensive Financial. We're actually going to be celebrating our 30th anniversary this coming January. We're independent. We're a boutique financial planning and advisory firm. My associates and I are all certified financial planners and registered fiduciaries, and we specialize in mainly financial planning, wealth management, and employee benefit work related to retirement plans and things along those lines. And then we have Senior Healthcare Solutions, and I'll let Mary take it from there. She could talk a little bit about that.
Yes. Hi, good evening, everyone. Stan, thanks for having me. So our company's Senior Healthcare Solutions, myself, along with my partners, Steve and Susan Maisto, we operate a family-owned and operated insurance agency in Babylon Village. We specialize in Medicare. We offer Medicare prescription drug plans, Medicare supplements, and Medicare Advantage plans to our clients. We are boutique in that we specialize just in Medicare health insurance. We can take you or your loved ones through the process of not only enrolling in Medicare, but get a Medicare education, and then we can help find the plan that best suits your needs. We're licensed throughout the country, not only in New York, but many states throughout the country. All of our services are of no cost to you, and we can prepare you for retirement at the age of 65 or beyond 65 if you're gonna keep working. So I look forward to the presentation tonight. Stan, thanks for having me.
No worries. And just for a little background, we've been working with Senior Healthcare Solutions for several years now. And any clients that we've forwarded over to them to help with this area of specialty have always come away with a great response back saying they never felt more comfortable with the work that's been done and presented to them. So wanted to share that with the world. And, if anyone does have questions, you'll have all of our contact information listed in the packets that were provided to you prior to this session tonight. And, again, at the end, we'll be able to take some questions. But at the bottom of your screen, there is a little button for a Q&A. And if you do come across that and you have a question, just put your question in there and we will get to it as we go along here. All righty. So I'm going to start now with some of the basics here. And again, just as an overview, I'm going to start off with some Social Security basics and some ideas on how to maximize your strategies. And Mary's going to be talking about all the various changes and the fundamentals of Medicare insurance. As the government and Medicare operate, unfortunately, we didn't get all of the insurance updates like we normally would anticipate at this time of year. We've only gotten a partial amount, but Mary is going to be talking to a lot of that and some of the trends that we're seeing. One of the areas that they did provide information, though, was on the Medicare Part D drug plans. As you may have been seeing in the news over the last year, the government has been negotiating certain drugs to be at a low copay and things like that. So that's all impacting the Part D benefits. So it's something that you should be aware of and understand some of the implications of that. So I'm going to get started here, and we're just going to talk again about the Social Security basics and some of the benefit types that most people are familiar with. Workers' benefits. So when you work and you contribute to Social Security, just so you know, on your paycheck, you'll see a line item that's called FICA. FICA is the Social Security contribution or tax that you're paying into the system. Your employer also pays the matching amount for your contribution. Now, in order to be eligible for worker benefits under Social Security, you have to be at least age 62, and you would have had to have paid into the system for at least 10 years or more. Generally, the calculations in this category are done based on your monthly payments, and they're calculated by your highest 35 years of earnings. Now, a lot of people come to me saying, well, I'm getting closer to retirement. Should I put in more overtime now and so on? And it does help to boost that number. But again, just understanding what your benefits are and what potentially they would look like, you can discuss that with a Social Security representative. So it's important to understand that there are people at Social Security that can walk you through some of these concepts and again, answer some questions for you. But as always, we're a resource for you. If you have questions specifically about whatever's going on in your own personal world related to this, please reach out to us. Now, the second type of benefit is typically a spousal benefit. The spousal benefits essentially, the spouse has to be at least age 62, and they would have had to have been married for at least 1 year to be eligible to collect 50% of the spouse's benefits at full retirement age. So understanding that in general is an important factor because there's always the calculation and conversation that goes around, well, depending on if my benefits are more or the spouse's benefits are more, which should we take? You automatically take the higher of the two. Now, if you are divorced, you are potentially eligible for your ex-spouse's benefits, and again, can receive up to 50% of your spouse's payments at their full retirement age. Again, you have to be at least age 62. The spouse has to be at least age 62, and the marriage would have had to have lasted at least 10 years, and divorced at least 2 years. And again, not remarried. So these are important factors when you're trying to determine what benefits you should be taking. Lastly, we have survivor benefits. So if a spouse passes away, the surviving spouse is eligible to collect at least 100% of the spouse's payments for Social Security. So if they were married for at least 9 months and they're age 60, they can apply for this. Again, ex-spouses can also apply for this as long as, again, they're at least age 60 and the marriage had lasted at least 10 years and currently unmarried. So those are some of the basic categories of benefits. There's also a whole host of other types of benefits related to disability, or if children are involved on a spouse's death, that the children could be eligible to receive some Social Security payments. These are very specialized areas. If you do have questions related to that, please reach out to us and we can walk you through some of those details. Now, again, going back to some of the basics, the earnings, again, are calculated based during your earning years. Again, age 62. However, to be minimum to collect benefits, but however, you can start this earlier, for example, if you are disabled. So if a disability occurs, you can apply to Social Security and receive benefits according to what your contributions to the program were based on your full retirement age calculation. And again, when we talk about full retirement age, you may recall a few years back, the government changed the calculation that if you were born after 1958, the full retirement age benefits started at age 66 and 8 months and then trailed up from there. Currently, anyone after age 60 is at age 67. So when considering when to take Social Security, which we're going to touch on in a little bit, these factors do come into play. And we're going to talk a little bit about some of the misconceptions here when it comes to the full retirement age idea. So again, the first main misconception is, benefits start right after you retire. The reality is that retirement and Social Security benefits are really two different decisions that you have to make. Realize retiring from your job is one aspect of this that essentially, sets you up with your current income from the business, whether it's a pension, 401k benefits, 403b, and so on. The decision to start collecting Social Security really depends on your age and also what your needs are at that time, which we're going to talk about in a little bit, and also some of the tax implications. The full retirement age, again, as we were talking about before, it's really, this is a number, an age number that is set by Congress for the Social Security Administration to calculate benefits. But in reality, the full benefits, maximum benefits occurs at age 70. Right now, it is listed as, you'll see on the slide here, at age 67, which is how the Social Security Administration portrays this to the public. But when you look at the reality for maximum benefits, really at age 67, you're only going to be receiving about 80% of the potential maximum benefits that you're eligible for. So going back to my initial comments, retiring is one thing, Social Security benefits are another. And again, you got to have that conversation around when you think you're going to need to start taking it or when you would want. And again, what the implications are going to be for your overall income and taxation. Now, talking about the primary factors around Social Security, again, as I mentioned before, was the thresholds for taxation. Generally, for 2024, if your income is below $25,000 a year as a single filer, you will pay no taxes on your Social Security benefits. If you are between 25 and 34,000, up to 50% of your Social Security benefit can be taxed. So understanding that, and again, whether it makes sense to start at a younger age or a later age can drive that conversation. If you're over 34,000 of income as a single filer, up to 85% of your benefit is potentially taxed. So important to understand that. For joint filers, the numbers are a little higher. Combined household income of 32,000, again, no tax. 32,000 to 44,000, up to 50% of the benefit would be taxed. And then anything greater than 44,000 can be taxed in upwards of 85%, depending again on the overall tax bracket. Now, a lot of people like to talk about when does it make sense to start all this? And again, what is my potential break even? So when we look at the calculations, and these are an approximate average, again, everyone's might be a little bit different depending on what the benefit amounts are in the calculations. But the conversation around this is if I start, and a lot of times people call and ask us this, what if I start at age 62 when I'm initially eligible to collect? The decision to start earlier than later, there's a lot of factors there. It could be your overall health, longevity, other income that you have, like I said before, coming to the household, and the taxation of those benefits. When we look at someone starting at age 62 versus starting at age 70, the break-even analysis is around age 80, that you would actually come out ahead after age 80 compared to starting at age 62. And again, just showing some other examples here at age 67, if you started at that age versus age 70, you have an age 81 break even. And again, because starting again at age 62 versus age 67, 78 is the break even point there. So again, a lot of factors to consider when we're looking at this type of an analysis. And again, what is the impact on you personally with regards to the taxation of the benefits? And again, do you really need to start taking them now, or can you wait till age 70 to start collecting? Now, maximizing the payments, as I mentioned before, again, are you in good health? Do you have a family history of longevity? Are you concerned about outliving your assets or income? Are you in a high earning, are you the high earning spouse? Options for future guaranteed income sources are limited at that point. Maybe you're still working and receiving regular income. Again, retirement has changed for a lot of people, and a lot of people are actually working well into the retirement because they find a more of a sense of fulfillment in engagement in their social context, and again, being out there and being a productive member in society and working, it gives someone purpose. One of the biggest challenges I find when someone says, I'm fully retired, and I have plenty of people that I know that have retired in their 60s, and they sit there going, oh my gosh, I'm so bored. So understanding what goes on and what your retirement potentially would look like for you, whether it's continuing to work, maybe you're going to help out with the family, whatever that may look like for you, traveling, you have to really make some decisions there. And again, understanding all of the factors that surround this decision are so important. We're just showing an example here of an individual. Her name is Jess. She's turning 62. She can start receiving 1,400 a month in Social Security, but because of some other factors, she decides she's wanting to wait until age 70 when she would collect about $2,500 a month. By claiming later, she's breaking even, as we described before, at age 80, and she feels it's a good decision for her. But again, she might have part-time work, family history of longevity, other income sources, whatever it may be. Understand what the individual impact of your situation is going to have on Social Security and what those benefits would potentially look like. Now, the bigger question that I've been getting a lot lately, and with a lot of the discussion around the budget deficits within the economy and so on, is related to, will it be there when I retire? For those of you that haven't looked at their Social Security statement recently, and I encourage everyone to do this, go on SSA.gov, Social Security Administration.gov, and pull up your Social Security statement if it's not being currently mailed to you. On that statement, it'll show all the history of all the payments you've made into the system and again, what your projected benefits are. But continue reading through that. Get beyond those numbers and start to read the other information and disclosures that they're providing. They have printed on their statement, and I looked at one today, that in the year approximately around 2034, the government is only going to be collecting approximately 80% of the money needed to pay out the benefits that they are promising to beneficiaries. So this becomes concerning. Technically, this becomes insolvency. Now, if this was a corporation, this would be a problem and they would have to close or go bankrupt. But we're dealing with a government agency here. The government will not let Social Security go bankrupt. So what they do is, they'll basically intervene as they have in the past. And most likely they're going to create some backstops to Social Security. They're going to change the full retirement age. Maybe it'll go back to 68 from 67. Younger generations would likely be dealing with that. Maybe someone born after 1990. The other option that they're considering, and I've seen some of these proposed, is increasing the FICA tax. Rather than capping it at a certain limit, it could be unlimited on earnings, similar to what happens with Medicare. So that, or again, just adjustments to how they calculate the benefits. One of the things that people don't realize is that Social Security was designed like a pension plan, but it was really only designed to provide about 40% of a worker's pre-retirement income. So if you had to rely solely on Social Security as your retirement benefit, you will likely be living close or above, slightly above the poverty level. This is a concern, and the government has been addressing this. You may, if you're still working and actively in the market, you may have been seeing some information coming down that the government is going to be requiring, New York is bringing this out very shortly, mandatory retirement plans for businesses with auto enrollment into a Roth IRA type arrangement. You won't get a tax deduction on the contribution, but it grows tax-free and it'll be through your payroll. They'll automatically pull money out. Now, this is in lieu of a company sponsoring a 401k, a 403b, or some other type of retirement savings program. But just realize that the government knows that this is a huge issue. The average person at age 50 only has about $100,000 saved for retirement. So seeing that and seeing what the pressure is going to be on the system, they're really trying to push it through that companies will actually be collecting your retirement contributions and forwarding them into a plan, whether it's a government-sponsored plan, like I mentioned before, this auto-enrollment Roth IRA, or some other 401k, 403b, or deferred comp type plan. And these are important. Realize if they're covering with Social Security only about 40% of your income needs, you've got to fill in that gap. Otherwise, you got to either make major changes to your lifestyle or, again, address your overall spending and, again, looking to provide that additional income. The biggest priority I can say to everyone is make savings for retirement a priority. make it a budget item on your monthly expenses, and automate your savings. Probably the best option for automating savings is through your employer with a 401k, 403b, or 457 type plan. But IRAs can also be set up with automatic monthly or quarterly contributions. You can set up these deposits on your bank, and they will forward in those contributions directly to your IRA. And again, provide you with, again, some supplemental income ultimately when you do hit retirement years. So as we go forward with that, I'm going to shift my screen share over to Mary, and she's going to pick it up from here because now we're going to talk about the Medicare basics.
All right, great. Thanks, Stan. Let me just get this open here. Okay, just get back to where we were. Almost there. All right, so thanks again, Stan. What we're going to do here is we kind of call this a Medicare 101, but it'll be a nice segue into some of the updates for 2025. As Stan mentioned, we don't have everything complete yet in typical government fashion. They really wait for the last minute. You can expect a full suite of updates for the Medicare premiums and rates middle of November. I'll explain at the end how you can get this information, and Stan and I can also provide it to you as well. But by understanding the basics with Medicare and how Medicare works, you can really understand the impacts of some of the changes that will be instituted on January 1st for next year. We are in what's called Medicare's annual enrollment period right now, which runs between October 15th and December 7th each year. So if you're already on Medicare and participating in a Medicare plan, this is the very short window of time that you are able to make changes to your Medicare plan. So it's always a good time of year just to refresh, to give yourself a refresher on how Medicare works, how your specific plan works, and then understand how the impacts or how the changes next year will impact you personally. So there's 4 parts to Medicare: A, B, C, and D. Okay. Part A is hospital. Part B is medical, which is doctors and testing and everything outpatient. Part C is Medicare Advantage plans. I'm going to dive into that shortly. And Part D is your prescription drug coverage. So Part A and B are called Original Medicare, and they're provided to you by the federal government. So the first question we address is, who is eligible for Medicare? In the broadest of terms, you are first eligible for Medicare when you turn 65. However, some people under the age of 65 would be eligible for Medicare if you have certain disabilities, okay? Or at any age, you are eligible for Medicare A and B if you have end-stage renal disease. But for most people, it's when you turn 65. So the most common question that we get is, when do you enroll in Medicare? Because there's a lot of information out there that could potentially be misleading. If you miss a deadline, it could financially impact you. Or if you apply too early, you might be enrolling in something you don't need just yet. So your first opportunity to enroll in Medicare is when you turn 65. It's called your initial enrollment period. And you have a 7-month window of time to enroll in Medicare. It's 3 months before you turn 65. It's the month of your 65th birthday. And then you are able to enroll 3 months after you turn 65. So you have a 7-month window. That's your first opportunity. Now, if you enroll in that 3-month time frame before you turn 65, Medicare A and B will begin on the first day of the month you were born. So if your birthday is May 20th, it'll begin May 1st. If you wait until the month of your 65th birthday or 3 months after, your Medicare benefits will just be delayed by 1 month. Okay. One little caveat is if your birthday is the first day of the month, August 1st, they actually give you Medicare a month early. So they'll start you on July 1st in that example. So if you're collecting your Social Security benefits prior to the age of 65, leading up to your 65th birthday, Social Security will automatically enroll you in both Medicare A and B In that 3-month window of time before you turn 65, you'll receive your Medicare card in the mail. Okay. You might not need both Medicare A and B when you turn 65 if you're still working. I'll address that in a moment. But if you're collecting Social Security, it's going to happen automatically. You do have the option to decline Medicare if you don't need it just yet. If you're not collecting Social Security in that 3-month window of time leading up to your 65th birthday, you will have to manually enroll in Medicare A and B. This can be done at Social Security's website, which is ssa.gov. You can go to your local Social Security office, or you can do this over the phone with Social Security. One thing I'd like to touch upon, since Stan just spoke about collecting your Social Security, there's a common misconception that when I go on to Medicare, I have to collect my Social Security. They're independent of each other. So when you turn 65 and potentially enroll in Medicare, you don't have to collect your Social Security if you're wanting to delay that benefit. But it's the Social Security Administration that will enroll you in Medicare. Okay. So this is very important to understand for someone who's turning 65, but they're going to continue to work and they have healthcare benefits through their employer. So when you're working, you have what's called a valid waiver to delay Medicare Part B without a penalty or any other implications if you meet 3 criteria. So when you turn 65, if you are actively working, receiving credible health insurance through either your own employer or your spouse's employer, okay, and that employer has more than 20 employees, you are able to delay your enrollment in Medicare for as long as you meet those 3 criteria. Okay. Again, you have to be actively working. The employer has to have 20 or more employees, and that employer has to provide you credible health insurance that includes a prescription drug plan. So if you're satisfying these criteria, you can stay on your company's healthcare plan. And this same goes for a spouse, if you're covering a spouse, okay, until you retire. And then you will be able to enroll in Medicare A and B at a later date without any disruption, without any penalty. At that time, let's say you retire at the age of 67 and you've been covered under your employer's plan this whole time, you will be entitled to what's called a special enrollment period that very simply your employer will fill out a form that's proving to Social Security that you've had healthcare benefits since the age of 65. And that's why you didn't choose to enroll in Medicare at the age of 65. And that is a rolling admission. So if you decide to retire at 65, you are able to enroll, if you decide to retire at, let's say, 67, you're able to enroll in Medicare A and B without a penalty, without a delay upon leaving your employer's plan. Okay. If you are getting COBRA, let's say, COBRA is not considered credible insurance in the eyes of Medicare. So you have to be very careful. All right. If you turn 65 and you say, I really like the healthcare benefits I have through my employer, I'm just going to get COBRA for the 18 months or the 36 months that is allowable, and you decide to not get Medicare, that could pose problems. All right. So just to make sure when you turn 65, if you're going to continue to work, don't take the COBRA. You have to be actively working. Okay. The employer has to be more than 20 employees, and you have to have credible health insurance. And then you'll have no issues in delaying your Medicare benefits. So this is one of these bits of information that Medicare is just really delaying in giving this information out. It's the Part B premium. I'll take a step back, though, to tell you that Medicare Part A, which is the hospital portion of Medicare, and in just a moment, I'll explain to you exactly what Part A covers. Part A is no cost to you. It's premium free as long as you've worked and paid into those Medicare taxes for at least 10 years. Then when you turn 65, Medicare Part A is free. It's actually not free. You've essentially prepaid for your Medicare Part A all of your working years. But when you turn 65, Medicare Part A will be no cost on a monthly basis, but Part B will have a premium associated. What a lot of people don't know is that what you'll pay for Part B is based upon your income. So this chart shows you what you could expect to pay this year for Medicare Part B. It's based upon how you file your taxes. If you file an individual tax return and earn less than $103,000, or a joint tax return and earn less than $206,000, you'll pay $174 for Medicare Part B. This is always per person. This is a monthly premium. Okay. Two things to note here is that when Medicare decides what you're going to be paying for Part B, they don't look at your current income or last year's income. They look at your income from 2 years ago to establish what you're going to pay in the current year. Okay. This could hurt some of you because most people earn more while they're working than in retirement. So if you are going to be set up at a higher rate for Part B, there is an appeals process that you can simply tell Social Security you've had a life-changing event, which in most cases is retirement or reduction of work, and they'll reassess what you're being charged for Part B. Okay. If you are collecting Social Security, the Part B premium that you see here will be deducted from your Social Security benefit. If you're not collecting Social Security, Medicare will bill you directly, but that bill will be a quarterly benefit. Now, as far as next year, the trend over the last few years is about a 6% increase in the Part B premium. All right, so directionally, that's what we could probably expect. Middle of November, we'll have those finalized numbers. And again, we can share that with you. So what I'd like to share with you is just Medicare itself and what Medicare alone covers for you and what Medicare doesn't cover, so you can understand the need for the additional insurance, which would either be a Medicare supplement or a Medicare Advantage plan. So again, these are the numbers for this year, but directionally, in general, you can expect a 6% increase to almost each line item here. Okay. So Medicare Part A, if you just have Medicare alone, just Part A, no supplemental insurance, there's no monthly premium for Part A. You don't pay for Part A itself. But if you're admitted to the hospital, you'll have a deductible of $1,632 that you'll have to pay for the hospital stay. And this will cover day 1 or up through day 60 in a hospital. God forbid that hospital stay exceeds 60 days. You are responsible to pay $408 per day. If that hospital stay exceeds 90 days, you pay $816 per day. These numbers are scary, but don't let them scare you too much, because that's why supplemental insurance is available to you, because that will pay for some or all of the costs that you see here. Okay? Now, if you go from a hospital to a skilled nursing facility for inpatient rehab, Medicare covers the first 20 days of that stay at no cost to you. After day 21, you are responsible to pay $204 per day if you're inpatient rehab. Beyond 100 days, there's no coverage. That's considered long-term care, and Medicare doesn't cover long-term care after 100 days. So then there's Part B. All right, that's at minimum will cost you $174 per month per person. All right, again, we're thinking about a 6% increase. We'll see in a few weeks. Part B covers doctor's visits and testing, anything outpatient related. You'll have an annual deductible of $240 for the year. Deductible means that you pay the full cost of any office visit or test until you've paid that full deductible. And then at this point, Medicare starts working for you, and Medicare pays the doctor directly 80% for the service or the testing facility. They pay 80%. You pay 20% of what's called the Medicare allowed amount. So although the Part B premium will go up, the deductible of $240 will go up, this 80-20% split will not go up. That won't change. Medicare will still pay 80% of your cost next year. You will be responsible to pay the remaining 20%. Okay. The next line item here is so bizarre. Medicare does cover blood if you need infusions, but they won't pay for the first 3 pints for whatever crazy reason. Who knows what a pint of blood costs? And then preventative testing, Medicare has a long list of tests listed on Medicare.gov that are no cost to you. Medicare pays for those in full. Things like mammogram, bone density, colonoscopy, glaucoma screening. The list goes on, but those are of no cost to you. So this is everything that you would be exposed to if you turn 65 or you retire and you just take Medicare A and B alone. So this is where you have some options at this point. Medicare A and B, original Medicare, is the foundation of everything. And then it's your job to build upon that to secure additional coverage to pay for some of those items that we just looked at. So you have two options. You have Medicare as primary, and then you can add on a Medicare supplement, also known as a Medigap plan, a prescription drug plan. The other option that you have is taking what's called a Medicare Advantage plan, all right, which puts your healthcare and your prescription drug plan all into one plan. I'm going to dive into each of these options specifically. And when it's your time to retire, that's when you'll really try to ascertain which route is better for you. Okay. So we first like to talk about the Medicare supplements. Medicare supplements are also known as Medigap plans. The most important thing to understand about Medicare supplements is that original Medicare A and B is your primary here. That is important because that allows you the freedom to go to any doctor, any hospital in the country. You have no network. And I would say comfortably 99% of doctors accept Medicare. So as long as the doctor accepts Medicare anywhere in the US, you are able to use your Medicare supplement. So Medicare's primary, the supplement is secondary. Now there's 11 Medicare supplements available. They go from letters A through N. They are offered by a variety of different insurance companies. You have United Healthcare AARP, Aetna, Humana, Globe, the list goes on. And we represent all of those companies. So each and every year, as things change, we figure out which company is offering the plan at the best rate each year. What we like to show you tonight is just a sampling of the 3 most popular plans. We don't have the insurance companies listed here, but what we are showing you is the lowest rates right now. And actually, just earlier today, we discovered what the rates for 2025 will be with these plans. So I'll share that with you. So Plan G is the most comprehensive plan, all right? It's offered by many companies, but regardless of which company you choose to provide you with your Medicare supplement, whether it's United Healthcare or Humana, if they offer Plan G, they are mandated to offer these exact benefits. So at $308 per month today, next year it will be going up to $368. If you're in the hospital, I'm kind of working down the column here. If you're in the hospital, you will have no co-payments, no deductibles. So everything we looked at on that previous chart, the $1,600 if you're in the hospital, that's all paid for on your behalf. With Plan G, all you will be responsible to pay is Medicare's deductible of $240. Once you reach that deductible, you'll have no copays for the balance of the calendar year. The cost of your Medicare supplement is in addition to what you pay for Part B, and there's no family plans or spouse plans. They're all individual. Okay. One step down is Plan N. A popular company right now offers it at $242 per month. It will be going up to $270 next year as of January 1st. Plan N, if you go down the column, you will have no copays, no deductibles if you're admitted to the hospital. You will pay Medicare's deductible of $240 for the year. And then once you reach that deductible, you will only have $20 copays for any office visit or $50 if you go to the ER. So if you're really trying to decide what plan is right for you, we kind of look at the simple mathematics of it all. So Plan N at $2,900 for the year, 242 times 12, okay, is, if you compare it to the Plan G, it's a little less than $1,000 less per month. Everything else is equal on these plans, with the exception of those $20 copays for your office visits or $50 if you go to the ER. So to make Plan G really worth your while financially, you have to have an awful lot of office visits to the doctor to make up that difference in premium each year. That's about 30 or 40 office visits per year at $20 a visit to make Plan G worth your while. So Plan N is a popular option. Then all the way to the right is Plan G Plus. It's also known as a high deductible plan. So this is the lowest cost way to be able to go to any doctor, any hospital in the country. It's $72 today, and it will not be increasing for next year. So the way that this one works is that it's more of a pay-as-you-go option. Still allows you the freedom to go to any doctor, any hospital that you wish that accepts Medicare. If you're in the hospital, you are responsible to pay that $1,632. We looked at that on the previous slide. You'll pay the same deductible that we keep talking about, the $240 for the year. Then Medicare is always paying 80% on your behalf behind the scenes. You will be responsible to pay the remaining 20%. Those will be your copays. But the beauty of the plan is that the insurance company keeps track of everything that you spend, which includes the hospital stay of $1,600, the $240 deductible, and each and every 20% copay that you pay. If ever your out-of-pocket expenses reach $2,800 for the year, the insurance company kicks in. They'll pay 100% of everything for the balance of the calendar year. So what the G Plus plan allows you to do is keep your monthly cost down, $72 a month. You maintain that freedom to go to any doctor that you like in the country, but you have the peace of mind and protection that your costs will not exceed $2,800. Okay? The Medicare supplement plans can be changed each and every year. Now, depending on the state that you live in, the premiums are different. These are specific to New York. The premiums are different, and I'm sure you could have guessed they're much lower outside of New York. We pay much more for everything here as far as the health insurance is concerned. But in New York specifically, you can change your Medicare supplement each and every year, no questions asked. The reason why we have almost the highest rates in the country for our Medicare supplement plans is because New York is considered a guaranteed issue state. What that means is that when you enroll in a Medicare supplement or you change from one Medicare supplement to another, New York is not allowed to ask medical questions. So they will allow you to change from one insurance company to another, regardless of your current health situation or any pre-existing conditions. They cannot turn you down. In other states, you will be asked 20 or 30 health questions. You will either be denied based on your health and your pre-existing conditions, or you'll be charged more based on your age or your health. Okay. So in New York specifically, it's not a lifetime decision. You can go into Medicare and choose a supplement as a starting point, and then you can reassess it each and every year to make sure that the plan has met your needs and you want to continue on with that plan. Okay, so those are the Medicare supplements, also known as Medigap plans. So with each and every Medicare supplement, you're required, and I kind of say this loosely, you're required to have a Medicare Part D prescription drug plan. I'm going to touch on this at the end, but this is where next year we are going to see the most disruption in Medicare. It's specific to the prescription drug plans. Okay. Today, there are 15 prescription drug plans available. Right. They start at $3.70 per month. They go up to over $120 per month, and many premium options in between. There's no prescription drug out there, no prescription drug plan out there, regardless what you're willing to pay for it, that just covers every single drug. Each and every Medicare Part D drug plan is required to cover every category of drugs. So that would be blood pressure medications, inhalers, insulin, and the list goes on. But there's no drug plan that covers every drug. Each plan is mandated to cover a certain percentage of brand name drugs and a certain percentage of generics. But it's very important that you have someone, whether it's yourself or your insurance broker or representative, do the analysis very closely to find out which prescription drug plan is going to best fit your needs. Because of the 15 options, you want to make sure that first and foremost, your drugs are covered for the upcoming year. And secondly, which plan will cover your drugs at the lowest cost. If you're on low cost generic drugs, almost any drug plan would work for you. But even one brand name drug if you don't have the proper coverage, the costs could be significant. Okay. Now, Medicare prescription drug plans, why I say loosely they're required is that if you don't take a prescription drug plan when you're first eligible, either when you turn 65 or when you retire and when you leave your employer's plan, two things will happen. You are not able to get onto a prescription drug plan until the end of the year, and then the new plan you choose will not start until January. And more importantly is that each and every month you've chosen to go without a prescription drug plan, Medicare will charge you a penalty for not taking a drug plan. That penalty will stay with you for life. So it's very important that you assess your prescription drug needs. You pick the plan that's going to best fit your needs, okay? And make sure you have a plan, because just like any insurance, it's protection, even if you're not taking prescription drugs, because you don't want to face those penalties down the road. And even worse, if you don't have a drug plan and you're prescribed a very expensive drug, you can't get onto a drug plan until the end of the year, okay? Between October 15th and December 7th, which is, upcoming, is Medicare's annual enrollment period. This is when each and every person on Medicare is allowed to change their drug plan. It's a very short window of time that Medicare allows you to do this once per year. So now on Medicare.gov, they've published all of the rates for the prescription drug plans for next year. The increases to the prescription drug plans and copays are shocking. I'll get to that in a moment. But it's all there for you on Medicare.gov. You can research your prescription drug plan, if it still covers your drugs, and you can find out your anticipated costs for next year. Okay. So far we've talked about once you're ready for Medicare, whether it's at age 65 or later in retirement, you have Medicare A and B, and you've chosen to take Medicare, a supplement, and a drug plan. That's one way to have your health insurance set up for the year. The other option that you have is called Medicare Advantage plans. It's also known as Part C of Medicare. So now we've talked about A, B, and C. It's called Part C of Medicare. Medicare Advantage plans are highly advertised. You see these bizarre commercials on TV with Jimmy Walker and Joe Namath. These are the Medicare Advantage plans. What they do is they combine everything we just talked about. They take your coverage for doctors and hospitals, Part A and Part B, and your prescription drug plan, and they put them into one plan rather than having the separate plans. They're popular because they are lower cost than Medicare supplements, and they often add some additional benefits in there, like they might have some dental benefits, vision, a free gym membership, coverage for hearing aids, and things like that. When you take a Medicare Advantage plan, your healthcare is now being managed by a private insurance company, okay? So there are a variety of different Medicare Advantage plans out there. Each county probably has 15 or 20 different options each year. What's most important to understand about a Medicare Advantage plan is that although you have to have Medicare A and B to qualify and pay at minimum that $174, Medicare is no longer your primary. So a private insurance company takes over your Medicare and they become your primary, they become your secondary, and they become your prescription drug provider. There's companies like Aetna or Humana. So when you do this, you become a beneficiary of this company. Medicare is no longer paying anything on your behalf. The private insurance company is paying your claims. So because of that, you no longer have the freedom to go to any doctor. You have to use that plan's specific network of doctors. Okay, and it's very important each and every year to check that your doctors still participate in the plan that you've chosen. Okay? They assign individual copays for each and every item. Okay, they have pre-authorization or possibly referrals, but they're much lower cost. And when I say much lower cost, most Advantage plan companies offer a zero premium option. Yes, zero premium. You don't have to pay for it. You still pay that Medicare Part B of $174 at minimum, but it's no additional premium. How is this possible? So this is possible because when Medicare, the risk for Medicare is greatly reduced if your healthcare is managed by a private insurance company. So when you take a Medicare Advantage plan, Medicare is essentially getting you off their books. You're no longer responsibility of Medicare. They are not paying in any form or fashion for your healthcare claims. A private insurance company is. So because of that, Medicare is actually paying on your behalf, the Advantage Plan company, and this year it's about $1,000 per person to essentially get you off their books. This is how the Advantage Plan companies can offer you zero premium plan or very low premium plans. Okay. Medicare Advantage plans vary by county and state, but this is a separate option from Medicare supplements. During the Medicare Advantage open enrollment period, at the end of the year, you're able to change your Medicare Advantage plan if you like, just like you're able to change your Medicare prescription drug plan each year. So to get into some major updates for 2025, the biggest impact is going to be on the prescription drug side of things, on either your standalone Part D prescription plan that you've added on to a Medicare supplement, or your prescription drug coverage included in your Medicare Advantage plan. That's where we are going to see the biggest impacts, okay? The impacts are in direct relation from what is called the Inflation Reduction Act. You might have heard about this. It's legislation that was passed in the government last year that will go into effect on January 1st. So right now, each individual person could potentially spend on prescription drugs $8,000 in total drug costs, okay? This is someone who's taking multiple brand name drugs, but it can happen. The government is reducing that limit from $8,000 to $2,000 per person for 2025. So if you're on multiple brand name drugs, this could really be a game changer, where now, if you've paid out $2,000 in prescription medications, your prescription drug plan is required to take over, and you will have zero copays for any of your prescription drugs as long as they're covered for the balance of the calendar year. Unfortunately, though, the government passed this rule, but the government has decided they don't want to pick up the cost of the drugs. The insurance companies are now required to pick up the cost of your prescription medications once you've reached this $2,000 limit. So in order for the insurance companies to be able to afford to do this and remain profitable, they're raising everyone's premium. Okay. The standalone prescription drug plans, if you have a Medicare supplement and a Part D prescription drug plan, we are seeing increases anywhere from 10% to 900%. That is not a typo. There is the lowest cost drug plan today is $3.70 per month. It's going up to $38.70 per month next year. That's the lowest cost option next year is $38. There are some plans that are going from $60 to $120, $70 to $170. So there are major, major price increases on the standalone prescription drug plans. Okay. Not only are there going to be increases to your specific premiums of your drug plan, the drug plans will be increasing their deductibles that you have to pay first. The deductible this year on most all prescription drug plans is $545. As of January 1st, that deductible will be raised to $590. But the bigger piece of it is that many drug plans today that do not have a deductible will now have almost a $600 deductible that you have to pay first before the insurance company pays anything for your prescription drugs. Okay? Beyond now having a deductible that maybe you don't now, the copays are going to go up. You might be used to paying, let's say $40 or $50 for a brand name drug. Now you are going to be exposed to, on almost any single prescription drug plan, 25% of the cost of a brand name drug. So when we look at something like an Ozempic, that's $1,000 a month at full cost. Today, we have many clients paying $50 a month for their Ozempic, okay? Next year, paying 25% of the cost, that equates to $250 per month. If you're on low-cost generic drugs, the premium of your drug plan will definitely go up by a lot, but the generic drugs are going to stay at low copays, $0 or $5. But it's the brand name drugs that are going to be impacted significantly. Those are considered tier 3, 4, and 5 drugs. For those of you who are on high cost brand name drugs, excuse me, there is light at the end of the tunnel. Okay, now that this $2,000 cap will be in effect, at a certain point in the year, if you hit the cap, your cost will be zero for the balance of the year. But essentially, your prescription drug costs will be front loaded to the beginning of the year. Medicare supplements that I touched upon, we're seeing those rate increases anywhere from 11 to 20% for the upcoming year. And then on the Medicare Advantage plan side of things, which are the Part C prescription drug plans, many Medicare Advantage plans are being eliminated altogether. They're just not being renewed for next year. They're reducing benefits. They might increase copays, remove things like vision or dental or gym membership. So that's the ways the prescription drug, the Medicare Advantage plans are being impacted, as well as the Medicare Advantage plans. Those plans include your prescription drugs, though, so those copays are going up pretty significantly as well. So the key takeaway here is that the biggest impact is going to be on the prescription drug side, but it really does affect everyone, even if you're not taking prescription drugs, because the premium of your drug plan will go up. Or if you're on an Advantage plan, the costs and the benefits of that Advantage plan are going to be reduced, or they might be eliminating your Advantage plan altogether. So it's very important between October 15th and December 7th to take a hard look at the plan that you're on, make sure it's still going to be affordable to you, and that it's still going to suit your healthcare needs for the upcoming year. We're definitely disappointed that we don't have the complete and updated rates for next year, but the Part B premiums, the deductibles, typically in the middle of November, we'll have those. It'll all be on Medicare.gov. The website is listed here, but Stan and I will come up with a way that we can share that information to you as well. All right. So with that, Stan, I'm going to pass it back over to you.
All right. Well, thank you, Mary. And if you just want to scroll to that next slide, thank you. We do want to open this up for questions. Haven't seen any getting posted as of yet. Just giving everyone a chance to type something in. All right. Well, all right. I'm guessing we did a good job here. There's no questions, but I appreciate Mary. Thank you so much for that. That was a great update on everything. And as I'm sure everyone else was benefiting from that, the prescription drug area is probably that big area that we saw the most change occurring. And thank you for all that update and detailed information. As Mary indicated, and we talked earlier, we're going to be sending out, once we have more details on the changes for 2025, we'll definitely be sending that out to everybody and sharing it. If anything pops up in the meantime, you have our contact information here across the bottom of your screen on the slides. And, reach out, any question, doesn't matter how simple or hard it is, throw it at us. We'll get back to you with an answer if we can get one. And, help you prepare for what potentially will be an interesting Medicare open enrollment season once we get all the details of this released and out in the public. So again, I wanted to thank everyone for attending tonight. Truly appreciate your time. And again, any questions, just reach out and let us know. Whoop, hold on, we have one question. Can I invest in a 401k and Roth IRA in the same year? The answer to that is basically depending on your household income. There is specific phase outs for the eligibility on a Roth IRA. So if you want to reach out to us more directly, I can get that to you. We would have to know some of the specifics about your personal household income and so on. There are different strategies, obviously, related to Roth IRAs that a lot of people are engaging in. You may have heard of backdoor IRAs if your income is too high, or within a 401k, there is typically a salary deferral option that is a Roth 401k feature. So that's something else that we can talk about with you individually that you can maximize. For example, in 2024, you are eligible to put away up to $23,000 into a 401k, and that can be done either pre-tax, like a traditional contribution, or post-tax with a Roth contribution. So there are some options there, but again, we can answer that more specifically if you want to reach out to us, and we can schedule a time to have some answers for you on that related to your personal circumstance. Any other questions? All right. Well, thank you, everyone. I truly appreciate your time. And again, we'll look for our follow-up information in the near future. Have a
All right,
great
great.
night.
Thanks so much, Stan.
All right. You
It looks
too.
like there's another question that just came in here,
Oh,
Stan.
oh. My wife is planning on retiring next March 2025. She is on my employer's health plan coverage, which is really expensive. Okay.
So yeah, so basically if you're eligible for Medicare, 65 years of age or above, a comparison can be made with the healthcare plan that you have from the employer versus Medicare and choosing a Medicare supplement or a Medicare Advantage plan. Many people stay on their employer's coverage for as long as they're working. In many cases, that's most cost efficient, but not always, especially these days where in some companies the employer's contribution is much less, or the employer's contribution is much less than what the employee is paying. So the analysis certainly can be done to see if it makes sense to stay on the employer's plan or to go on to Medicare and take a supplement or an Advantage plan while you're still working. So we can absolutely help you with that analysis.
Okay. And we have one more. When I turn 65 and I am actively working and my employer has greater than 20 employees and I have credible health plan, do I still have to sign up for Medicare?
So the answer is no. If you meet these three criteria, you're actively working, the company's greater than 20 employees, and you have the credible health insurance that provides prescription drug coverage as well, you can stay on that employer plan. And this goes for a spouse too, if you're covering a spouse, for as long as you're working. Okay. And then we recommend getting in touch with us 2 to 3 months prior to your retirement. You'll have a special enrollment period that can take place as you're leaving that employer plan, and you can go on to Medicare at any age, penalty free, without any delay or disruption, as long as you maintain those three criteria.
Okay. Any additional questions? All right, I'm not seeing anything else coming into the queue here. One more. Follow-up. The employer coverage is expensive, but pre-tax. I want to have my wife go on to Medicare, but lower my expenses.
That's certainly a possibility. And again, we can do the analysis for you to tell you exactly what it would cost to go on to Medicare and a plan that would suit your needs. And you can see how that compares to the employer coverage, and we can certainly help you with that.
Anyone else? Give it another second here. All right. All right, well, I guess that's it for tonight. Again, any additional questions, you have our contact information. Please reach out to either Mary or myself, and we can get you set up and on the right path for whatever your needs are. Again, I want to thank you all and have a wonderful evening, and wishing you all the best as we head into the year end and the holiday season. Take care.
Thanks, Sam. Good night.
Good night, everyone. Good night, Mary.